Well, a warm welcome and thank you for coming back. It's Sunday the 23rd of February 2020. Now, my main message today is to the World Health Organization, and that is, I believe we are now in the early stages of a pandemic. And I'm going to give evidence for that in this video. And to be quite honest, I don't quite understand why the World Health Organization has not declared this event as a pandemic at the moment. It's easy to criticise from the outside, but it seems to me that a lot of the World Health Organization's thinking till now has been reactive. Something happens and they kind of react to that, almost reluctantly. Almost, you might think, as late as they could react. Whereas what we need now is proactivity. We need to be thinking ahead, declare a pandemic, stimulate the funding that's required, stimulate the preparation that's required, and let's get ready for the international spread of this that is occurring, which we're going to look at now because the evidence is there. So just to start off here with some headlines. Sunday, 23rd of February. As we've said many times, that is the virus. Severe acute respiratory syndrome, coronavirus 2. The disease is coronavirus disease, COVID. Coronavirus disease identified in 2019. Now, there's something that concerns me about today's figures that I've got partly from Johns Hopkins and partly directly from the live Chinese site, and I'll tell you what that is. So current confirmed cases, these are people that are actually sick at the moment, who actually have the disease at the moment. Now the accumulated confirmed, we know obviously is growing higher all the time. So obviously that's going to carry on increasing, but in China the rate of increase has decreased. So it's still increasing, but it's not increasing as quickly. So that's good. Suspected cases are that, mostly in China. Now this is what concerns me. Current severe cases. Now this is the number of current confirmed cases. And this is the number of current severe cases. And according to my sums, that is 20%, nearly 21% of cases are severe. And this is an increase in what we've been seeing in the past. So the Chinese data is saying that of the current cases, 20.7% are severe. And this is concerning because if we have larger numbers of cases, we cannot cope with 20%, 21% of them being severely ill. We simply don't have the medical facility to do that. And that will mean that the case fatality rate will rise. So this has been a concern of mine for some time now, and it continues to be a concern, verified by that Chinese data. Confirmed deaths at the moment are 2,463. Recovered is going up nicely, so that's good to know. 2 negative smears, no fever for 10 days, and improving chest x-ray. We're going to talk about this and the basic reproduction rate. The disease is roughly doubling every 7 days, but we'll see there are exceptions to that where it's going much quicker than that. So I want to look at a few international situations now to justify my suggestion, strong suggestion, that we are in the early stages of a pandemic. Now, first of all, I want to say something about the case fatality rate. And this is from calculations by Australian epidemiologists. Now, globally, they're saying the case fatality rate, including China, is 3%. And this is artificially high, we believe, because of the large amount of unreported cases at the start of an epidemic. So the case fatality rate here might appear artificially high because of the large number of undiagnosed cases. But there again, as we've said, that is counterbalanced by the fact that a lot of people die at home and the disease is never reported. But on the overall balance, the early stage of the epidemic, it's more likely that we're going to get over-calculations for the case fatality rate. Now, outside mainland China, the case fatality rate so far is 0.9%. As far as we know from the data that we have, it's 0.9%. So it's looking like that the mortality rate is going to be between these two, hopefully nearer this one here. But as we've said, the case fatality rate is going to critically depend on the quality of medical care that is available. Now, Australia. 22 confirmed cases, 8 Queensland, 4 in New South Wales, 6 in Victoria, 3 in South Australia, 1 in Western Australia. And 10 of these are reported to have recovered, and the rest are described as being in a stable condition. So presumably that means they're not severe and they're not critically ill, although stable technically means you're not varying, it's just staying put. Now, I've heard different reports about Australia. The Australian government claim to be well prepared, but I've talked to quite a few clinicians and people who are well informed on the ground in Australia, and they say the situation is much the same as in the UK. The government's saying they're well informed or well prepared, but that they are already fully stretched as things are, and to have extra cases would be very difficult for them. So they're fully prepared, so they say, but in actual fact, when you challenge and say, well, could you take 1,000 extra cases, the answer is no. So a bit of a mismatch between what the Australian government and the UK government are saying and the reality on the ground, as far as I can see. And that's based on first-hand reports from clinicians in Australia. Now, South Korea. Not good news, I'm afraid. 2 days ago, they had 206 cases. Yesterday, they had 433. Today, Sunday the 23rd of February, 602 cases. Officially reported in South Korea. Diagnosed, officially reported. And I do trust these figures. The South Koreans are very exacting in this sort of thing. 3 deaths reported so far. The epicentre is still Daegu, this city where there was this religious meeting, and 1,000 people from that religious group now have symptoms and have been told to self-isolate while the authorities try to get round to test them all. So it looks like 1,000 people from this religious group might have contracted the infection. But as well as Daegu, the city Daegu, there's quite a few other provinces in South Korea which are reporting cases that seem to have arisen without any obvious epidemiological connections, which is concerning. And of course, there's no cases in North Korea, if you want to believe my sarcasm. Now, Italy. This is another convincing reason why I think we need to call a pandemic, because Italy has been caught really by surprise here. Yeah, there's no other way to describe it. They've been caught on the hop. So 3 cases 4 days ago, 30 cases yesterday, probably more than 100 cases today, with 2 deaths confirmed. Now, the epidemiology here is quite confusing. There was an initial person from China who they thought might be a super spreader, who they thought the disease had come from. But when he was tested, he was negative for the virus. Now, I assume they're going to test him again, but so far he's come back negative for the virus. So, was this disease spread from somewhere else? Did it have an alternative cause of infection? That's possible. Does that mean there's already community-based self-perpetuating spread in Italy? That's possible. Or does it mean that someone's transmitting the disease and they were negative or are negative? Or does it mean that they are now negative but they were positive? We don't know. We don't know what it means. But what we do know is people have tested negative who have not been infected, who have been kept in isolation and have subsequently tested positive. So we have to say that the PCR testing is unsatisfactory at the moment. We desperately need an easier, quicker, cheaper test. But to get back to the case in point, the Italian situation, where this epidemic came from, is unclear. The most likely probability is that this person from China was positive, spread the disease, and then his immune system cleared the disease and he remained fairly asymptomatic. which of course is concerning in itself because he could become a super spreader. Now these are in North Italy, so the Italian government has invoked special powers to close off 12 towns where people are banned from entering or leaving. Roads closed, rails closed, towns shut down. Very similar to the situation in Wuhan, in Hubei province in China. And very wise of the Italian government to do so, I would say. Football matches are cancelled, which is quite a big deal in Italy. If they cancel football matches, you know something's wrong. Universities in this area of the north are closed for a week. I think schools probably are as well. And the authorities are still working on this possible super spreader. Now, the World Health Organization is very concerned about Iran. And I'm remarkably concerned about Iran as well. I'll tell you why. Well, I'll tell you why now. I've had several emails from people in Iran, medical and non-medical people in Iran itself and expatriates from Iran, and they are remarkably concerned. Now, the official figures I've got are 43 cases, 8 deaths in Iran, officially. Unofficially, I've heard there's many, many more cases than this and many, many more deaths. Now, it's been reported to me by reliable, sensible people in Iran that, or Iran as you'd say in the States, but in Iran there are apparently a very high proportion of more serious cases. Now, I have had some death rates quoted to me, but I'm not going to quote them because they're just from one individual clinician, so I'm not going to report them, but they are significantly higher than 3%. Now, why is this? Is it because the disease isn't being properly diagnosed and people are dying from another type of pneumonia, or that's possible? Or is it, and this is what really concerns me, that there is a strain of the virus which has mutated to become more virulent? Now, this is quite possible because the virus that's infecting people in Iran has been isolated presumably for a period of time. Those strains of the virus could mutate, whereas others in China or other countries might not have mutated, but the Iranian one could have mutated to become a more virulent strain, and thereby increases the case fatality rate. And I have heard a lot of people getting respiratory failure in Iran, and I've also heard of people getting viral myocarditis of the myocardium of the heart, both of which I find really quite frightening. Now, I just listened to the big boss in Iran. I don't know quite who he is, some Ayatollah, I think. And he said that the opposition were trying to reduce the number of people turning out to vote by using COVID-19 as an excuse to keep people at home. Now, if we've got that kind of mentality, that really is a problem. Because there is a problem in Iran. The scale of it isn't known, but to politicise it when people are sick and people are dying is not good. Now, Gilan province in northern Iran, one doctor died last week. Now, this hasn't been officially reported, but I have been reliably told this by people from Iran, who obviously I know of but will remain completely confidential. Now, this doctor, before he died, had worked for a full week in a hospital without any quarantine. So he'd been working normally for a week. Then he got sick and then he died. So there's no real question he would have been incubating the disease when he was working in this hospital. So it's inconceivable that this doctor hasn't spread the disease, to be quite honest. And apparently his colleagues, through a friend of a friend of a friend, have told me that he caught the disease while he was working in a small town 4 weeks ago. So again, just like Dr. Lee in China, we're talking about a 28-day period between getting symptoms and dying. Don't know how old this doctor was, but presumably he was otherwise fit and well. Now, another thing that's concerning there is he caught it in a small town. So that means that the COVID-19 was already in some random small town in northern Iran. The disease was already in the community there 4 weeks ago. That's concerning. How far could it have spread in Iran in that time? Now, Tehran District 13, the 13th district of Tehran, the mayor is infected, known to be infected. But the mayor just attended prayers on Friday prayers. Upwards of 10,000 people were present, all standing close together for the Islamic prayer. And apparently at the end of the Islamic prayer, they are, they sit close together, and there is cultural kissing on the face and shaking hands. I don't need to spell that out, do I? The risks for cross-infection there are huge. Kissing on the face and shaking hands. Now the town of Qum in Iran is shut down, but the rest of the country is open to travel. So two really concerning things there. It seems to be gross underreporting of cases in Iran, and this fairly strong anecdotal evidence. And this has come to me from two completely separate sources. One in Iran, one an expat, that the death rates in Iran are higher. And these sources aren't in contact with each other. So this may well be the case, that the death rates are higher. So quite a lot concerning me there about Iran. Now, Indonesia. Again, I've been getting emails from people, clinicians and concerned members of the public in Indonesia. And Indonesia at the moment has no confirmed cases, but a doctor there has told me they have no test kits. And I heard of a patient who went to the doctors with a fever and a cough, and the doctor said it can't be COVID-19 because there is no COVID-19 in Indonesia. I do hope that doctor's right, but we don't know. We don't know. Now, hand washing isn't done very often, and apparently people are ridiculed who do wash their hands as part of some aspects of Indonesian culture, which is concerning. Now, in Indonesia, there's many people with uncontrolled, indeed unrecognised and undiagnosed diabetes mellitus type 2 and hypertension. Now, this is quite common in Asia. For example, you might remember about 10 days ago I talked about the case of the Thai taxi driver who developed COVID-19 from a Chinese tourist. And he went into hospital. He told the nurses and doctors he was fit and well, but it turned out he had quite severe hypertension and quite severe undiagnosed diabetes mellitus type 2. There is a global epidemic of these two diseases, to be fair. And in Asia it's particularly bad. So the main symptom of uncontrolled hypertension is that you get no symptoms. And even with diabetes, very often you don't get symptoms, or they come on so insidiously you don't notice them. You might get some blurring of vision and predisposition to infections. But very often the first that people know about this disease is when they come in with complications. I've seen this a lot in Asia. People will come into hospital not when they develop diabetes, but when they get gangrene in their toes or when they get renal failure. Quite an appalling situation. But can you see that these are both conditions which are now almost certainly predisposing comorbidities to people getting the infection and getting more severe versions of the infection. So it's as if the field is ripe for harvest in Indonesia almost by this disease. There's a fair amount of poor nutrition in Indonesia. There's a lot of poverty, poor housing, people crammed together in relatively small areas very often, and in most places limited health care. So if there's no cases in Indonesia, I would be delighted. But I suspect there might be. Now, United States, 18 of the 239 passengers who flew back from the Diamond Princess tested positive when they got back to the States. So these people were already positive on the Diamond Princess. Now, these are all in quarantine now, but of course those 18 could have infected those, although they did say that precautions were taken. But from what I can gather, it looks like some of these weren't recognised as being infected when they were on the flight. And this is a concern. People sometimes test negative only to subsequently test positive. This is a problem. The American CDC is working with state and local health departments to ready the public health workforce. So to respond to a possible. So the CDC is talking in terms of a possible pandemic. So good to see that the the American Centre for Disease Control is taking this as seriously as it is. Other countries, including my country, including what I can gather in Australia, for example, are not. How this is transposing onto changing the ground in the United States, I don't know. But officially, this is what they're doing. The CDC is preparing. Collaborating with partners, hospitals, pharmacies, manufacturers, getting the PPE, get the medical supplies, get everything that's needed in. So that is now being done in the States proactively. How many actual cases there are in the States, of course, we don't really know. The CD is reviewing all of its pandemic materials and adapting those for COVID-19. So again, on paper, that looks reassuring that the United States is preparing. And we often think of the United States as having good healthcare, but I get so many emails and questions from people from the United States, have done for years, who basically don't have access to good healthcare, who can't afford good healthcare, who have had very poor quality healthcare. So you get absolutely world-leading healthcare next door to very poor healthcare and people that often can't afford healthcare and can't afford medications and can't afford to buy enough insulin and things like that. So we think of the States as being very advanced, but there is a bit of an undercurrent of questionable healthcare provision in the United States as well. And finally, the UK. 100 people have been released from quarantine. They've come back from Hubei. Now, from Wuhan actually. All these 100 people have been in quarantine for a fortnight, and they've all got no symptoms, no fever, and they've had 3 negative tests. So, yeah, okay, I'll accept that. They've had 3 negative tests. I don't know how far apart they were. That information hasn't been released. And the Diamond Princess passengers are still quarantined and have no updated news on those. So just to conclude this video, I think I've given evidence to suggest that we've got almost certainly a degree of community spread. And the disease is now so widespread, it's reasonable to call it a pandemic. What I would expect is further cases and further spread over the next few days. Now, I think the World Health Organization will call a pandemic, but I think they'll do it as late as they can and reluctantly as they can, and they'll do it reactively. So the final plea is to the World Health Organization, let's act proactively on this and get this pandemic status declared, and let's get the world geared up for the pandemic that I believe is coming.